"Are you transgender?" "What's that?" little Brandon asked. "A boy who wants to be a girl," his friend replied. These quotes come from two young boys at a trans health conference in Philadelphia a few years back. At the conference, transgender men and women in their 50s described life of heartache and rejection, years of hiding makeup, estranged parents, and suicide attempts. Those in their 20s and 30s carried a different tune. They wore nose rings and mohawks, ate strictly vegan, and conducted heated debates about definitions of queer, he, she, and drag queen. But the kids there showed a completely different way. They treated the conference like a family trip to Disneyland. All of these people suffer from a disorder known as GID, Gender Identity Disorder. And there's three main things about the disorder that I want to talk about. First, a little bit of its history and what it is. Second, the effects it has on a child's personal well-being. And third, the evolution of society, to show how and why GID should and will soon be socially acceptable. As many of us probably have never come across a transgendered person, I hope I can help you achieve a greater understanding of what they go through and why they should be accepted the way they want to be. So first, a little history about the disorder and what it is. It's a condition in which a male or female feels a strong identification with the opposite sex. It's the formal diagnosis for children who experience significant gender dysphoria. The disorder must be diagnosed by a trained or certified mental health professional, a psychologist, or a psychiatrist. And although the cause is not known, several theories do exist. One theory says it is caused by genetic abnormalities or problems with the chromosomes. Another theory suggests a hormone imbalance during fetal development. Also, defects in normal human bonding and child rearing is also a theory. This theory actually pertains to parents who actually persuade and encourage their child to become a transgender. This is not something I support or promote. Most transgender children experience their first thoughts between the ages of 3 and 5. Symptoms include isolation, anxiety, and withdrawal from society. They have a belief they will grow up to become the opposite sex. Also, they experience serious disgust with their own genitals, and they wish to dress like the opposite sex day in and day out. The parents may be able to hide their kids' wishes through their toddler and preteen years, but as puberty hits, this is a very horrifying time, and the effects on their personal well-being begins. Since the problem is internal, the kids have no one to blame but themselves. They become victims of bullying immediately upon enrollment in school. Over 85% report verbal abuse, nearly half report physical abuse, and 1/3 report actual physical assault. They fall victim to high rates of drug abuse, depression, violence, and suicide. Just over half make an attempt on their life before the age of 20. They are diagnosed with non-existent learning disabilities because they are so misunderstood as kids. Since it is kept a secret, the real cause of what's going on with them, schools treat the symptoms rather than the cause. Teachers label them dull or different because they have no idea what's going on. As a result, transgender kids achieve lower grades and are less likely to pursue higher levels of education. If we can educate the rest of the children in the classroom, harassment in the classrooms will greatly decrease, creating less fear among the transgender kids in hopes of creating more aspirations for them to achieve that higher level of education. Now that you have seen some of the effects it can have on a child's well-being, some of us may still argue that boys are boys, girls are girls, and that's just the way it is. Some may argue that this is just a phase, and it's also been proven that sometimes this is just a phase, but also sometimes it is not just a phase. This is not something kids always grow out of. But looking back at our country, perhaps our country is going through a bit of a phase right now pertaining to the transgenderism. We've crossed many societal bridges in our past and seen society evolve, whether the people are ready for it or not. To give a few examples, racism, of course, the dynamics of family life, and also homosexuality. Racism in the beginning The reason for racism in the beginning was basically that blacks weren't a normal person per se. It's a very low blow, but this is how some people see transgender these days, is that they're just not normal like the rest of us. The dynamics of family structure is not what it used to be by far. The days of there must be a mom and dad in the family are long gone. The number of single parent families has greatly skyrocketed, and more same-sex couples are adopting children, which has become socially acceptable. Homosexuality used to be highly frowned upon. Along with same-sex couples adopting children, some states are also allowing same-sex marriage. Also, the repeal of Don't Ask, Don't Tell policy in the U.S. military is a great example of how far along our society has come. Homosexuality was removed from the DSM as a mental disorder in 1973, and I think it won't be long before transgenderism follows suit. So to wrap this up, by no means am I supporting parents to encourage their kids to be something they're not. I'm saying if you come across one of these unique situations, one of these situations where it's not just a phase, try to find some understanding in these families and try to support what they have. The best solution is education, so try to inform your children of how these transgender kids, their peers, are different from them and how you can support them. Don't be a bully. The best we can do is support and accept as friends, family, co-workers, or classmates.